The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning, Dr. Mencia. We have him
Bright
for a
and
whole
early.
hour today,
Yay.
which is great, so we're not going to run out of time. And you have your coffee with you.
I have my coffee. I'm enjoying a little cup of coffee in the morning.
But it's
with
not
you.
just any kind of coffee.
It's not any kind of coffee. It's my Ganoderma, yes, with the mushroom and all of that.
Well, I need to ask
really
you
special.
about this. I've been drinking the coffee, and of course, you know, I'm a person that likes sugar in my coffee or sweet and low, and I know sweet and low is not good, and I try not to do that. I'm using just plain sugar. I am finding that if I just
Do
put...
you use brown sugar or...
Well, no, I don't. I'm not... I don't use brown sugar. I use something, actually, that's called... it's a natural sweet and low. No, it's not Splenda either. No,
brown sugar.
No. Oh, he has brown sugar. No,
Yeah.
but there's another thing that's a natural sugar that doesn't
that comes
have.
from the leaf or something.
Yeah, I have
that's
that,
good
like
too.
stevia. So I've been using that.
Right.
But even
okay.
so, even I don't use that now. I can take a little milk with this coffee. For some reason, I don't know why.
It's the mushroom.
Is it?
It's the
a mushroom.
Ganoderma. It's the Ganoderma.
Because
I'm drinking the Cafe Supreme, and it has ginseng that gives you energy. And
I didn't know there was that.
Yeah. This one has ginseng, and it has. Let me see.
It has ginseng
the
in
mushroom.
addition. What does it have?
The mushroom, 100% certified Ganoderma extra. That's the latte, and here we go.
Then you have something that
Cafe
has.
Supreme, ginseng powder and coffee blend with 100% certified Ganoderma extra.
So it has ginseng also. Why
so
don't
it
I
has
know
the
about that?
two-
Let me see that. Do I have any
Yeah.
of that?
You can have-
I think I do, but I haven't had that. Cafe Supreme.
Open it up. It's really good. It gives you,
I'm going to smell it. Just hold on a minute.
you can taste it too.
Oh, my goodness. Oh, wait a
And
minute.
you don't
That's
have to.
fantastic.
I don't add anything. I just mix it and put my hot water and I drink it. It's really good.
and because it looks like there's cream in it.
Yeah, nothing.
What's
Just-
in it?
Just
It's a-
whatever is here. That's it. Just your,
It's fantastic.
It is fantastic.
It is
tastes
fantastic.
good.
Well-
It gives you a lot of energy. Curb the appetite. I lost already 9 pounds.
Wait, you couldn't. Wait a
9 pounds.
minute. You're
Yeah.
not 9 pounds.
Yeah, my clothes feel looser, and I lost 9 pounds. I'm doing nothing different. I still do same exercise routine I always have done. I eat the same way. I always have eaten healthy. I'm a healthy eater. I don't like junk food, and it's just 9 pounds out of fat coming from somewhere in my body.
Oh my, that's amazing. Well, I have to tell you that I am losing some of my appetite for that junky stuff, which
And
I
I
don't
li-
try
I-
to eat, but I will. I've been eating apples. I'm eating a lot more apples, and when I have coffee, I really forget about eating, and I don't know why that's true.
It curbs the appetite, and that's why people in Asia. I first heard about the mushroom in China. I used to, when you go to China a long time ago, now it's expensive, or more expensive than then. But when you go to China, you see a lot of the taxi driver sipping on tea as they are driving. When I became friendly with the taxi driver, I say,
What are you drinking?
so what is it that you're sipping on all day there? So he says, the Ganoderma tea. I say, why? Well, it sort of curbs the appetite. In Beijing, it's a huge city. It's like New York City. So they see all the advertisement, all the fast food and all the things. So they try to curb the appetite. So when they are driving in the street, they don't have to stop and start eating, junk food. And they save their money. So they sip on tea all day.
Well, that's a very important point because maybe we should step back a minute and tell everybody what we're talking about. I think you introduced this to me about 2 months ago, 3 months ago?
No, even. Less than 2 months. Yeah.
2 months. Mm-hmm. And it's coffee, it's tea. I use
Chocolate.
the toothpaste. Sorry, I'm big. I use the toothpaste. And it has the reishi mushroom in it, right?
Exactly.
And you have been introduced to many, many things, and I know you. Everyone's attracted to you. They see that you have a great business, medical business, and they say, wow, let's see if Dr. Mencia wants this. And I know you've rejected most things.
I reject a lot of things.
But this was brought to you, and it's because of, I think, of your love of Asian exercise, and this is very important to you. So,
well, growing up in Hawaii, I grew up with nature. So when I heard about this having the taking something like the Ganoderma lucidum mushroom and fusing it into coffee, I say, I don't know how good would that be. And when they really was one of my patients that introduced me to this. And I just put it to the side and never really tried it. One of my staff tried it, and they say, what was that? That was really good. It gave me energy. What was it? I say, one of my patients say has, it's a really super food, is Ganoderma lucidum. So we started doing research on the mushroom. And the more we researched, the more stuff we found. We found like this thing that was all about how in Asia they use the mushroom to prevent cancer and do all those things. I said,
right.
And how it's good for circulation, to improve circulation. It's good for the memory. It's good for muscle toning. It's good for cleansing the liver. And we spoke about the liver, how important it is for processing food and processing all the medication that we take and all of that. I say,
that's very big.
Really, really
very
interesting.
Important.
So it boosts the immune system, it gives you energy. So the more I research, and this had nothing to do with our company. It was like completely independent research we were doing, looking at the product, just at the pure mushroom. So we started blindly giving it to people in the office and say, try this. I want to know how you feel, your experience. And one after the other, they say, wow, whatever it is, it has to give me a lot of energy. I feel good. And I remember one of my staff, he was getting sick. Juan, with the chief...
Because he was drinking too much coffee,
chief medical
right,
assistant.
or something?
No, he was just catching a cold. From all the
oh.
sick patients that we see, he was catching a cold. And I needed him in the office, and he said, I'm really feeling I'm coming down with something. I said, why don't you try the tea? Because he has the mushroom. Now you're putting it to the real test, because this is not just somebody feeling good that want to feel better. This is somebody that was feeling sick, that the immune system was being overtaken by a viral.
This is the green tea.
Yes.
I love the green tea that they drink.
So he started drinking the tea, and at the end of the day, he said, I feel great. I'll be here tomorrow. I really feel good. I said, take some tea home because I need you.
No, it's true. And, I brought this to you when I get a magazine called Cancer. Let's see. It's called... I forget. Cure. No, it's called Cure. Mm-hmm. Cure Today. Mm-hmm. And you had just talked to me about this. And here in this magazine that's telling you all about the science of cancer, and it gives you many articles about people and who've suffered from cancer and all the different procedures. And here's this thing that says, reishi is remedy. Certain properties in mushrooms may prevent and fight cancer. I couldn't wait to give this to you and say, look, this has nothing to do with what you're talking about.
Completely independent source of information.
I know.
And, it's been great, all the information that we had tapped on looking at this. So I'm very, very happy to have partnered with this company and having the product basically being brought to my patient. And then the company also had the pure capsule, the mycelium, the spora, the Ganoderma, and the grapeseed extracts.
Yeah, tell me about that, because that's
imagine when you're drinking the coffee, you are looking for the the energy and boosting the immune system and what have you. But when you have a person that has a high risk of cancer and they're really trying to fight more than just drinking coffee, or you are not a coffee drinker, you don't want the coffee, you might want just the tea, or you don't want none of that, but you want the product. So you can have the pure product. So I have a patient that
Excuse me, how is it taken? In a capsule?
The capsule, yeah, you take one capsule. If the grapeseed extract is so strong that you take one capsule a day is enough.
What is grapeseed
extract? Well, imagine when you drink wine, we say wine is good for you, right? Because it has a lot of antioxidant property in the wine. So one grapeseed extract is a little bit less than half a bottle of wine, as if you had drank half a bottle of wine. All the product that you are pulling out from all the benefit that the wine gives you, okay? But you don't want to drink too much wine because then you become an alcoholic. But you can have just one capsule of the grapeseed extract. And it's yesterday I was watching a program on Dr. Oz, and he was talking about the benefit of coffee, especially what they call the green coffee. And the green coffee is the coffee that have not been processed a lot. So, coffee per se, if you process right, if you partner the coffee in the right way with the mushroom, there's a lot of benefits. And in Dr. O's program, what they were talking was about weight loss. And so, it's a lot of souls that are very respectful, like the wonderful Well of Wellness,
That's right.
That have spoken about the benefit not only of weight loss but boosting the immune system. So it's I'm very happy to become a spokesperson and informing people about the benefit of Ganoderma lucidum. And, you try to buy this product that pure out in the market is super, super expensive. So imagine being able to getting the pure product in a capsule at a very reasonable price.
Well, now, this is a company that's been doing this, for about 8 years?
Only 5 years.
5 years. But, it has been in existence for...
It had been in existence, and it's, if you look at the portfolio of the company, it's amazing. So it is a company that since it took off, it just had been doing very, very well. And what it had done basically is very smartly taking a mushroom and fusing it with the coffee. 1.6 billion people. I'm sorry, 1.6 billion cups of coffee we drink a day. So what they're saying, if coffee is a habit, why don't we fuse something good to the habit to make it better?
I agree.
And I have a patient that chronic smoker, and he had tried so many ways of quitting cigarette smoking and have not been successful. So he just tried, he went to my office, he tried hypnotherapy, and so far I think he's on his 8th month smoke-free, 8th month. And I say, he said his father have lung cancer, and his father have lung cancer, and his mother has breast cancer. So a very, very strong history of cancer. Yeah, very strong history of cancer. And so he said, I'm so into prevention now. Now that I quit smoking, what else can I do to help me fight the cancer? So we say, there is this Chinese mushroom called reishi or Ganoderma lucidum, and there's no guarantee. There's nothing out there that will guarantee anything, but at least it's known to help you. In Asia, it's very, very popular all over Asia. You talk to anybody in Asia. I was talking to a friend of mine in Singapore, and I was saying, your country just approve Ganoderma, Organo Gold is a company that fuses this Chinese mushroom with the coffee and tea. They say, which mushroom? So I say, reishi. They say, of course I know reishi. We all buy reishi in the store, so they knew what reishi was. So he started Googling the company together. So they just opened up in Singapore on January 1st of this year.
Well,
So it's expanding a lot.
Yeah. Dr. Mencia, I think people probably at this moment want to know what they can do to get this. So let me just tell you how to do this. You can actually either call Dr. Mencia's office at 954-489-1345. That's 954-489-1345. Bingo. I always say with my numbers, I know it's like reading bingo. Or you can actually go to what he does now. Go to his website, which is menciacafe.com. That's menciacafe.com. And that way you'll be able to get see all the information. I have a number if you want to talk about the coffee. It's a different number, but I really like you call the office because that way
because that's 24/7.
Yeah,
but don't call at 3 o'clock in the morning.
No, that's right. Unless you're having an emergency, but we want you.
It's for medical emergency.
Right. But of course, Dr. Mencia is here for you, and I have to tell you, as our doctor, he is really. There's just nobody that does what Dr. Mencia does in his way. He does this. He handles people in a very, very interesting, unique way. And once you're with Dr. Mencia, you just can't go anywhere else. So this, Dr. Mencia, you have a guest this morning.
Yes, I have invited Dr. Sui, who we met about 2-3 months ago.
A few months ago.
3 months ago. And tell us a little bit about what you do.
Sure. Well, thank you for having me
He's
this
cute.
morning.
I don't know what else.
I only bring you handsome guy.
What did 1, 2, 3, 4. Here I am.
I appreciate that also.
Okay, tell me exactly what your name is.
My name is Warren Swee, and
So how do you spell your last name?
SWEE.
SW.
Yeah, I say it's like sweet without the T.
SWUEE.
No, SWEE.
Oh.
Sweet without the T.
Yeah. Oh, without the T. That's very funny. Okay.
Just with the coffee.
I thought you were. Yeah, I thought you were sweet. I said no, I'm not.
Okay, sweet. All right, we got that. So what do you do that has made Dr. Mencia so interested in you?
Well, I'm a physician, and I specialize in vascular and interventional radiology. So it's a lesser known specialty, and that's because there's so few of us. But the specialty essentially allows us to do minimally invasive procedures or surgeries using image guidance. So the image guidance, which uses X-rays and CAT scans and MRI, allows us to do a procedure through just a tiny opening in the skin, no larger than about the size of a pencil tip, and we can treat things that used to require a large open incision. For example, and I just treated a patient with a large aortic aneurysm yesterday. So that's a condition when the aorta, a large artery in the abdomen, balloons open and it's at risk of rupturing, and that can actually cause death. So the old way of treating that is to make a large incision across the abdomen, remove the bowel, get down into the main artery and surgically repair it. It's a very big procedure, but we're able to do it through just 2 small openings in the groin arteries and repair everything from the inside of the arteries. And we can watch our instruments, which are guide wires, balloons, and stents, be placed inside the vessel in the correct place using X-ray guidance.
What hospital do you practice at?
Northwest Medical Center and also Bethesda Hospital.
Okay. I didn't. It's interesting. What is the difference in an interventional radiologist and an interventional cardiologist?
Our primary training is different. So a cardiologist will come out of internal medicine as their base training, and then have a specialty years in fellowship, interventional cardiology. Whereas a radiologist, we have our base training in radiology. So I'm also a diagnostic radiologist. I read images. Then we have additional fellowship specialty training in procedural interventional procedures.
Interesting. Dr. Mencia, I have had a lot of interventional physicians on, and that word now is becoming very common, but it's with their specialty. That's what you're saying, isn't it? Did you deal with cardiology where other people? Is there interventional orthopedics?
Well,
Not yet.
Well, orthopedic, they are interventional. They do
it's
procedure.
coming. It's coming.
But you know, the important is it's just like the how rare is geriatric medicine, and with the huge demand that we have in geriatric medicine, is the demand is so big out there for us as geriatricians. So interventional radiologists, basically, and that's why I'm so happy that to be able to work with Dr. Sweet, because a lot of the patient, the old-fashioned of treating a lot of the people that has a wound, and you will try to treat the wound for a long, long time, just with superficial management. Where now Dr. Sweet Group, they are able to go there and look at the procedure that they are doing, where before we used to do it blindly. So we will try to canalize a vein or an artery blindly, and hopefully that we are on the right spot, and either put a stent in there to open it, where the way the procedure is done now is so precise that they make a tiny, tiny incision. It's like having a needle stick. And then the whole procedure is, and they are watching what they are doing.
I'm just going to ask, so you're young, and I'm wondering, you don't know what it's like. I love that. So that's good. Well, so you retained your... My question is, if it were not for computers, would we not have interventional procedures? I mean,
Yes.
computers have really made a big difference.
We absolutely need computers and great scientists and engineers, and because what we do interventional, like you said, we're seeing that word and hearing that word with multiple different specialties. It's because of this skill set of using image guidance. So it's not just limited to radiologists. Other groups are also learning to use this, but it's based on high quality CAT scan imaging, high quality X-ray imaging, which is very heavily based on computer technology.
I have to tell you something about Dr. Mencia that you may not know. I don't know how long you've known him. He is like a computer and imaging in his brain. I mean, he doesn't have to have a computer. He just looks at you. It takes a few minutes, and he's got it right down. I mean, you are an amazing man. And I say that because I've had a personal experience with him this way, and his patience. And I know you use computers, and I'm being a little facetious with you. But Dr. Mencia does have a intuitive. You know, there are intuitives.
Yes.
And we've never discussed that. And I've met, there was a Russian doctor who was an intuitive. And he could just look at you, and very quickly he could tell you what was going on. And I've never said this to you, but I think you have a lot of that intuitive
Well, yeah,
part.
when I'm and I think it's probably my martial art training, the discipline. When I'm working with a patient, I try to avoid getting distracted and concentrating on each patient as a book that you are reading. It's an individual case. And when I'm teaching the student from Nova University or FAU, when I'm teaching the student, I try to tell them, listen, if you want to practice medicine and you're going to be anything related to clinical aspect of medicine, you have to be a good clinician. And to be a good clinician, you have to be a good observant, you have to be a good listener, and you have to know when to speak, when to just basically absorb the information being given to you. And a lot of time I make observation just watching my patient walk, watching my patient sit down. And same thing with Dr. Sweet in his specialty. When he see a extremity, feeling the temperature of the extremity, taking the pulse, before he even take an X-ray or ultrasound or anything like that, he already has a image of what could be wrong with that leg. And the beauty of what Dr. Sweet Group, what they are doing now, compared to 5 years ago, we can go, not too far back. A lot of people were losing extremity because we didn't have people like him, so easily accessible. So what I want the audience to do, the listener, please grab a pen and pencil, because I'm going to give you his phone number, and they have several locations, and I'm so happy to work along with him, because he had helped me cure so many of my chronic wounds. Because the problem is sometimes it's not that the skin is too thin. We all have bacteria all over our body. But when we have poor circulation, then those bacteria, the immune system is not able to go and fight those bacteria as they used to. Those wounds will appear, and they are so hard to treat. And a lot of times, they get skin graft. The skin graft will not take. And it's because we didn't have the specialty that he provides now that bring to the picture that help people wound heal so much faster and prevent people from losing their toes or losing a foot or losing the whole extremity because of poor circulation. So it's important that you jot this number down, look into his website, and if you come to the office, you can ask for a referral. And we'll be happy
give that
to send you
information when we come back
when
from the
we
news.
come back.
How
Yes.
about that?
Sounds
okay?
like a plan.
Okay, thank you. We'll be right back.
This is Money Talk Radio, AM 740.